Hey doctors, if you have ever mixed up measles with rubella or cannot quite recall what causes blueberry in muffin baby, and this is your moment to shine. Today we are diving into the red rashes of childhood, torch infections, and those classic bugs in unvaccinated kids, a favorite on the USMLE. Grab your coffee, plug in your headphones, and let's make these high yield topics stick forever. Let's begin with the red rashes of a childhood, a classic step on table you absolutely need to master. Start with measles caused by paramyxovirus. It kicks off with fever, cough, coryza, and conjunctivitis, and then boom, the coplic spots appear on the buccal mucosa like tiny white grains of salt. Soon after, a maculopapular rashes erupts, beginning at the hairline and spreading down the body. Think starts at the top and showers down. Next up, scarlet fever, which is due to strep pyogenes or group A streptococcus. This one follows a recent strep throat or impetigo and features a sandpaper-like rashes. Next up, scarlet fever, which is due to streptococcus pyogenes or group A streptococcus. And this one follows a recent strep throat or impetigo and features a sandpaper-like rashes plus the famous strawberry tongue. Now, the itchy one, that is varicella or chickenpox caused by varicella zoster virus, and these vesicles come in crops, some new, some crusted, usually starting on the trunk and then spreading outward. You will never see all the lesions at the same stage. Moving on to rubella, a gentler cousin of measles. Its rashes is fine and pink, begins on the face and moves down rapidly. So the buzzword here is posterior auricular lymphadenopathy. Then there is roseola caused by HHV6. This one fools you. The kid has a high fever for several days and then suddenly the fever breaks and then the rashes shows up. That reversal is a very important clue in your exam. And lastly, erythema infectiosum caused by parvovirus B19. The iconic slapped cheek rashes gives it away. Don't forget, this one can cause hydrops fetalis if a pregnant woman gets exposed. To lock it all in, here is your mnemonic. Very sick people must really rest. Again I repeat, very sick people must really rest. Varicella, scarlet fever, parvovirus, measles, rubella and roseola. Now let's shift to torch infections. These prenatal threats you cannot afford to miss. Number 1. Toxoplasma gondii is transmitted through cat feces and causes chorioretinitis, hydrocephalus and intracranial calcifications. Rubella through the respiratory droplets presents with a triad, cataracts, deafness and patent ductus arteriosus. And then CMV spreads via saliva or urine and leads to periventricular calcifications and sensorineural hearing loss. HSV2, often transmitted during delivery, causes skin, eye, mouth lesions and can progress to encephalitis in the newborn. And syphilis, passed via the placenta, presents with snuffles, rashes on the palms and soles, and those weird Hutchinson teeth. USMLE loves to throw in the term blueberry muffin baby, which refers to extramedullary hematopoiesis and is seen in torch infections. Now on to our final zone, bugs in unvaccinated children. If you see measles, rubella, pertussis or tetanus in a winglet, think of missed vaccinations. Measles presents with the same rashes, coplic spots, and remember the 3 C's: cough, coryza and conjunctivitis. Rubella shows a milder course with posterior auricular lymphadenopathy. Epiglottitis caused by Haemophilus influenza type B is an emergency. Drooling tripod position and dysphagia are your red flags. Pertussis from Bordetella pertussis comes from paroxysmal cough and a whooping inspiration that's unforgettable. And finally, tetanus from Clostridium tetanus causes spastic paralysis and locked jaw, due to inhibition of inhibitory neurotransmitters like GABA and glycine. Your mnemonic here: my real enemy is poor tetanus coverage. Measles, rubella, epiglottitis, pertussis, and tetanus. Let's do a recap. Remember, measles for Koplik spots and rashes down from the hairline. And then scarlet fever for sandpaper rashes with strawberry tongue. Varicella, remember vesicles in the crops. Rubella, remember face to foot rashes with auricular lymphadenopathy. Remember roseola, remember the LA for later, rashes later. Fever first, rashes later. Parvovirus B19 for slapped cheek and fetal risk. Torch clues: toxo for cat poop, CMV for periventricular, rubella for PDA, HSV remember birth canal, and syphilis for snuffles and notched teeth. Unvaccinated child with disease clues: remember time to think vaccine failure and answer confidently. You have now got all the must know pediatric rashes and infections in your pocket, and these are easy wins on your exam if you link clinical patterns with causative agents. Keep showing up. Every minute you will spend learning now will pay off with extra points on your step 1. Let's go crush the next topic, and this is Dr. Ram here. See you then.